You're someone with a vision for your practice, for your side hustle, and for your personal journey. But when it comes to establishing your path on how to get to where you want to be with your practice, things get a little messy. You're also someone who'd prefer to go in person instead of to groups and listening to everyone else's story. To me, it sounds like you could benefit from one on one consulting with our experienced practice of the practice consultants. From $5.95 a month and up, you can work with a consultant that will give you more direction and practical, tried and tested tips matched to you and your goals. For more information, visit practiceofthepractice.com/apply. Again, that's practiceofthepractice.com/apply. This is the Practice of the Practice podcast with Joe Sanok, session number 978. I'm Joe Sanok, your host, and welcome to the Practice of the Practice podcast. I am so excited that you are here today. I remember when I was doing my internship at Catholic Family Services in Kalamazoo, Michigan, and I had this priest who was also a clinically trained psychologist. He was a school psychologist. He was a priest on the side, and he was my supervisor for my internship, Dr. Bob. And Dr. Bob, he was a really unique guy. I don't think he loved the idea that I was going to be sitting in on his sessions. So I only had the summer to get in all my hours, and they just didn't have enough people for me to see to get in all the hours that I needed. And so they had said that, I could sit in with Dr. Bob and watch him do sessions. And that counted as direct supervision because I was, sitting with him and direct client work. So it met whatever, the direct time was that I needed compared to the indirect time. And I remember towards the end of my internship just being like, I cannot believe that the world is about to release me into the world to do therapy without having, somebody that's like sitting beside me or talking to me every day that, I'm going to get this blessing and I'll be, pre-licensed. In Michigan, it was a limited license. But, no one was going to be there to make sure I was doing a good job. It was so weird to go from, during my practicum, they had the one-way mirror and the whole class was on the other side to, half my time sitting with Dr. Bob. And he walked through this thing for me that has really stuck with me, not just in the clinical world. And you guys have probably heard it a million times, but it's that at first you don't know what you don't know. And then you know what you don't know. Then you don't know what you know. And then you know what you know. And for me, that was so helpful that I had transitioned from in that internship, just not even knowing what I didn't know, to then being so fearful of my own confidence going into the field that I mostly knew what I didn't know. And I, that year after grad school, bought treatment planning books, bought all these different ways to just have some sort of confidence within the work I was doing. But the first 2 years that I was out of grad school, I had people at a nonprofit that were literally just signing off on the notes. They weren't really doing active clinical supervision. They weren't building that confidence in me and challenging me to think differently. And that's why I'm so excited that we have Shannon Heers with us today. Shannon is a therapist, an approved clinical supervisor, and the founder of Firelight Supervision. Firelight Supervision provides clinical supervision to counselors and social workers pursuing licensure, as well as clinical consultation for post-licensure professional growth and development. Shannon is also the owner of Catalyst Counseling, a private pay group practice located in Colorado. And Shannon is passionate about decreasing therapist isolation, preventing burnout, and providing private practice therapists the support they need and they deserve. Shannon, welcome to the Practice podcast.
Thanks, Joe. Thanks for having me.
Yeah, I'm so glad that you're here. And, just thinking back about my early stage, just development and confidence, I'm really excited to talk about clinical confidence today.
Yes, I think a lot of clinicians can really resonate with the story you told, whether it was an internship or, as a provisionally licensed counselor and then becoming licensed and being unleashed on the world and being fully responsible all by yourself for everything that you do, or even those therapists that transition into private practice. Maybe they have a prior career in agency work or some other type of hospital work, and then they move into private practice, and that can also trigger some confidence challenges. So I think a lot of us, I loved your story, and I think a lot of us can relate to, if not the specifics, at least the emotions that went through us when you realize that you're in private practice and you're out there alone and responsible for everything that you do.
Yeah, and I don't know what your experience was like, but I know that my first couple years out of grad school, when I think about my entire career of counseling that, went from 2004 when I graduated to 2019, so 15 years till I sold my practice. So 15 years of clinical work. The most difficult, challenging, complex cases that I had were in those first 2 years. It was when I was in the nonprofit world, it was when I was getting child protective services referrals, it's when I had people that were in multiple systems of care, so kids that were on both probation and had mental health issues and had a psychiatrist. Like, oftentimes it seems like our hardest cases and our least paid people and often least competent people, and I'm not saying that new clinicians are not competent, but they're just brand new, they get the hardest cases. And so just thinking about, like, how did I not just like give up on this field in the first couple years?
Yeah, and we remember those cases most specifically. Those cases, tough cases we had in the first few years. I mean, I still remember the first time they put me with. I have no idea why. Kind of like you, I'm like, why did they do this? But I was a case manager, and they assigned me to someone who was, I don't know, probably 40 years older than I was. Not the age makes a difference, but she had been through many case managers before and had significant trauma history, had a borderline personality disorder diagnosis, lots of challenges, was on a boatload of medications, chronic suicidality. And I was like, oh my gosh, you want me to work with her? Like, can I really do it? I mean, I learned a lot, but there's no way I could have done it on my own. I worked within a team. I had a supportive supervisor. We had a psychiatrist that we worked with. My colleagues that, had experience in conceptualizing cases. I couldn't do it alone. And I remember having that same feeling, but for a different reason when I moved from community mental health, where I had worked for maybe 15 years, into the private practice world. The cases weren't as challenging per se clinically or as complex clinically, but it was completely different. It was someone who wanted to come into my office and meet with me, and someone who was having just as many challenges, but in different areas. Maybe they weren't as functionally impaired by what was going on with them. But I had to change my mindset and be like, okay, it's not no big deal. This person is really coming in because they have a lot of things that they really do want to work on. And just because they aren't as complex clinically as some of the prior people I had worked with, it was really hard to change my mindset into working with that population.
Yeah. So let's kind of deconstruct clinical confidence. That's an area that I know you specialize in. When you think about clinical confidence, if we just zoom out, to big picture, take us through maybe the phases of clinical confidence, and then I'd love to dig in more to kind of what happens in some of those phases.
hmm Well, I think clinical confidence, first of all, as I mentioned earlier, can affect clinicians no matter where you are in your career. Certainly, it's going to affect newer clinicians because you just don't have as much experience or knowledge in the field. But it can also affect clinicians when you're maybe learning a new specialization or you're working with a new population, or like I mentioned, you're moving into private practice from agency work. So, clinical confidence can kind of affect you no matter where you are in your career. And there's lots of different things that encompass clinical confidence. A lot of people think, oh, it's imposter syndrome, and you just need to get over imposter syndrome. And that would be great if it was that easy, but it's not. Some of the foundations of clinical confidence, and this is based on confidence research, are one, your competence as a therapist, how good you are, not just how good you are at what you do, but how well attuned you are to the theoretical orientations that you're using, and when you know how to use those interventions in those orientations, so you know what interventions to use and when to use them. That kind of encompasses competence, and that's one of the foundations of clinical confidence that I think we're all aware of. But there are a lot of different areas of clinical confidence that we don't necessarily think of. For example, adaptability is one, and that means just basically the transferable skills that you have as a therapist and working with maybe one clinical population, that you can transfer those skills to working with a different clinical population. So that's, working with a wide variety of people. There's also effective communication and interpersonal skills, how you work with your clients and you share your confidence that you can help them. So that's another component of clinical confidence. There's many others, but it's not as simple as like just getting good at what you're doing. There's a lot of other factors that are included in that.
Yeah. Where does the intersection when you're early in your career, where does kind of overconfidence that's based on not having the experience overlap with kind of underconfidence because you're brand new? Because I know that in my program, I'm sure we all have the people that we can think of that they were too clinically confident for the phase that they were in. Like, what are your thoughts on that kind of early phase confidence and like where that sweet spot is?
I think it goes back to when you said you don't know what you don't know. And I do see some overconfidence in some of those earlier stage career therapists, and that they really get attuned to maybe one particular theoretic orientation, which is great because you get to know that orientation in and out. But then the confidence that they have is really just based on only that work. So if they have anyone coming into their office or seeing virtually on the screen that doesn't necessarily, fit in or really benefit from, the way that you work, um, that can be a challenge for sure. Um, Absolutely knowing your tools that you want to use and knowing the interventions that you want to use and when to use them is really important for confidence, but it's not the only thing that's important for confidence. I can sit with a client in my office and I can bring out all the CBT tools, that I have and that I know and that I've used for years and years and years, but if CBT does not resonate with that client, it's just not going to be helpful. And so I think that's one of the challenges of earlier career therapists and really relying just on kind of one set of tools to do most of the work.
Mhm. Now, I know a number of our consulting clients and people in group practice boss are considering growing a teaching practice. So they're bringing on people during practicum or their internship or their pre-license or limited license, depending on the state. What tips do you have for them in regards to building clinical confidence in those that are joining their practice, either for practicum, internship, or pre-license?
I think just remembering how new maybe a practicum and an internship student are. We're talking about, I know that different parts of the country use the word intern differently. So we're talking about master's level students coming in and getting their work experience with you while they're in school. So I think just remembering that maybe, depending on the experience of these student interns, they might not ever have sat down across from a client before. You're really going back to basics with them. You're talking with them about what it's like to structure a session, timing wise, because I do out, 50-minute sessions all day. And so I have an internal timer in my head. I've developed that through the years, but newer students don't necessarily have that. So you're really going back to the basics of developing that therapeutic relationship with them, connecting with them, assessing different symptoms, assessing different challenges and problems, coming up with a case conceptualization. You're really doing some of the basics with that population versus when you get people who are maybe provisionally licensed or even early on in their independent license. They have those basic concepts down, and you're really working with them to expand their case conceptualization. What are some other possibilities? What are some other ways to work with this client? Because as we know, there's never one right answer. And then finally, really integrating who you are as a therapist with who you are as a person. You want your values about how you feel that people heal and get better, to really be aligned with your values, your how you work as a therapist, and the theoretical orientations you choose, and your approaches, and even your style of how you work with people. You can have two therapists who use the same, really adhere to the same theoretic orientation, but yet have very different styles. So those are the different stages that you're going to work with developing clinicians on. on clinical
Yeah.
confidence.
Yeah, I really remember in grad school, I was in a class where one of the professors was trying to make the point that the modality doesn't matter, but it's the clinical relationship. Like that's what they were trying to say. And I remember being like, then why are we even learning modalities if they don't matter? And just that idea of just the nuance or the art of therapy in addition to the science and that diversity within it. And it just is such a skill for new clinicians to learn. As a therapist, I can tell you from experience that having the right EHR is an absolute lifeline. I recommend using therapy notes. They make billing, scheduling, note taking, telehealth, and e prescribe incredibly easy. Best of all, they offer live telephone support that's available 7 days a week. You don't have to take my word for it. Do your own research and see for yourself. Therapy Notes is the #1 highest rated EHR system available today, with a 4.9 out of 5 stars on trustpilot.com and on Google. All you have to do is click the link below or type promo code Joe on their website over at therapynotes.com and receive a special 2-month trial absolutely free. Again, that's therapynotes.com and use promo code Joe on the website. If you're coming from another EHR, Therapy Notes will also import your demographic data quick and easy at no cost, so you can get started right away. Trust me, don't waste any more of your time and try Therapy Notes. Just use promo code Joe at checkout. Now, if we kind of step farther into someone's career, what are things that more seasoned clinicians and maybe even when they're supervisors or even owners of their practice, like how should they be evaluating their own clinical confidence?
That's a good question. I think that one thing that I always encourage people to do is no matter where you are in your career, make sure that you have someone you know and you trust that can provide clinical feedback to you. I still get my own clinical supervision. I don't do it weekly anymore, but I still have someone I know I can go to say, hey, I have a new client. Here's what's going on. Am I missing anything? Or here's how I'm conceptualizing this. What may be some different ways to do it. So just making sure that you're not neglecting yourself as you continue on in your career. I think a lot of people, once they get fully licensed, they say, oh, I'm done. I don't need supervision anymore. I'm out there on my own. And that to me is one of the scariest things ever in our field, is having a clinician who is isolated and doesn't have anyone else to bounce ideas off of, or to get support in the case of urgent or emergent issues. We always hope that things like that don't come up, but in reality they do, and they will come up in your career. You will have an urgent or emergent issue to deal with at some point in your career, and you never want to be dealing with it on your own. So I think that's one of the things I encourage more advanced clinicians to do, even if it's just a clinical consultation group that you're a part of. Now, when you get to the point of maybe you're a practice owner or providing supervision for others, I still don't think that goes away. Even if you're continuing to provide clinical work, you want to make sure you're getting the clinical support that you need. It may look different than it now than it did earlier on in your career. Maybe you want to be a little bit more choosy about what type of consultation group you join or who you get that consultation from. But again, you want to make sure you're never working in a vacuum in isolation.
hmm I think part of that also points to just kind of the human aspect, and that's that as humans, hopefully, we're just developing as people, that we're growing, that we're having life experiences that challenge us, that we have to work through things. I think about if I was doing therapy, before I sold my practice, with someone who had gone through a divorce, the way that I would approach that session is way different than now having uncoupled and have sole legal or physical custody of my kids, and all the s storm that was 2020 till, well, in a lot of ways now. Like I just have a different empathy. And then I had to deal with my own emotions around when there's things that I can't control that affect my kids. Like, how do I deal with those emotions? What tools work for me? What makes me a better person? How do I stay grounded and peaceful and loving towards the world and not just become like bitter and jaded? Like, that's just the human side of, becoming the kind of person you hope that you'll become. And I think that when a therapist is doing that, that's naturally going to help their therapeutic work to just have confidence when, if I had someone come in now, if I was still practicing, that was dealing with really rough things, I've personally gone through things that I have tools to use. Now, I don't necessarily buy into the argument that to have a good therapist, they have to have gone through everything that you've gone through, or everything their clients have gone through, because then you'd have someone that might just be a whole trauma train wreck. But I think that, to have gone through some life stuff and sorted through that, that helps you with your confidence. Like, what are your thoughts on that kind of just personal development side of it, informing your own clinical confidence?
Hmm. So I'm thinking about countertransference as you're talking about this. And countertransference doesn't ever go away. But hopefully, as you continue on and get more experience and you've dealt with it more often, you're able to recognize it sooner. And you're able to say, okay, I might be having some countertransference. And then taking a step away, how do I manage it? Who do I talk with about this? I mean, I remember a story where I think it was several years ago, but I was meeting with a woman who's very similar to who I was as a person. And I think we get that a lot as therapists as you continue to specialize. So it was someone who had young kids, just like I did at the time, was struggling with kind of doing everything, struggling with working and being a parent and her relationship. And it was really, really important for me at that point to say, okay, I'm going through, I can really resonate with what some of the things that my client is telling me in session. And how do I make sure that I still am a good therapist to this client? Because you're right, things happen in life. Like, therapists are not immune to things happening to us. We have grief, we have loss, we have breakups, we have divorces, we have new family additions, we have job transitions. There are so many things that we deal with that everyone else deals with. And so it's going to affect us, and it's going to affect our work, because, as you know, we are the instruments for our own work. And how are you managing that ongoing? I mean, I, of course, always encourage people to do your own work in therapy, but how are you managing it professionally also? And I think that is just something to know, that you cannot be this complete blank slate. The more life experience you have, the more you may be able to understand different clientele. But again, you still want to make sure that you're effective with them and your own stuff isn't getting in the way.
Yeah. Well, when you think big picture about owners looking at their own, especially group practice owners, looking at the clinical confidence of their team, sometimes your team can start to grow and kind of get away from you in a lot of ways, whether that's keeping track of progress notes or keeping track of billing or whatever. What should practice owners be thinking about when it comes to the clinical confidence of their teams and how to build that and foster that?
One of the things that I do on my team is I have probably half my team is provisionally licensed. So they have an assigned supervisor, and the other half is not. They're independently licensed. They've been around for a long time. But I make sure that every single person has kind of someone they can go to um, on the team, regardless if they're fully licensed, especially if they're fully licensed, because the provisionally licensed people usually have their supervisor as their first contact. So I make sure that my licensed and experienced therapists are not out there on their own, that they know that they have a consultation group that they can go to, or an assigned, kind of colleague that they can go to if they're having trouble with a case. I think that really helps build the confidence, because they realize, again, they're not out there on their own. And we talk about the concept of a team as a group practice, but in reality, you're doing so much independent work and you're still working a lot of the days in isolation. You have very little contact with your other team members. So, how can you really facilitate that team coming together? I mean, yes, team building activities and stuff like that are great, but maybe on a little bit of a deeper level. And so that's one of the things that I like to do with my team.
Mm. Now, what else have we missed? I know you cover a ton of this in webinars and in other trainings. Like, what have we missed around this topic of clinical confidence?
I think one of the things is that making sure I think I touched on this earlier, but really as you develop as a clinician and as a practice owner, whether you're a solo practice owner or a group owner, you want to make sure that one, you're focusing on the business and marketing skills, which is what you guys do, Joe, very well, which is great. But you want to make sure you're not neglecting your clinical growth because that's also going to dictate the success of your practice. If you are a fantastic therapist, you're going to get more clients coming to you. Now, you can't just be a fantastic therapist and neglect the business aspect of your practice, but you can't also not focus on your clinical growth and just focus on the business because you may get clients in, but they may not stay if you're not continuing to grow and develop as the field grows and develops. So, I think that's one thing I like to focus on also is the link between your clinical skills and your confidence, and how you show that confidence with your clients and the success of your private practice.
Mm. The last question I always ask is, if every private practitioner in the world were listening right now, what would you want them to know?
I would want them to know that if they are feeling alone, you're not the only one. There are so many solo practitioners out there that are feeling isolated and alone, and they don't have anyone to talk to about their cases or their tough work or this client they just saw that was like triggering something in them. You don't have to feel alone. There are places you can go, there are groups that you can join. You can get individual consultation if you're looking for it. It is accessible now, and it's so much more accessible now with all the online options. If you're working somewhere rurally and in a rural area, I don't think rurally is a word, in a rural
Mhm.
area, and you don't have a lot of clinicians around you, you can still get clinical support. You can still help get some of that growth and development and that feedback so you can develop more clinical confidence.
Well, if people want to connect with you, if they want to hear more about Firelight, where should we send them?
Yep, go to our website. We'd love to see you there, firelightsupervision.com. And on our homepage, we have a really long but really informative clinical confidence ebook that has several different areas in it that talks about different ways that you can continue to build your clinical confidence as a clinician. And it's free. So
Mm.
it's right on our homepage. Just jump over there, grab it, check out what we're all about. We have a number of different online clinical consultation groups, as well as we offer a therapist development in monthly trainings in different clinical areas. We're trying to really kind of create a community of therapists so people aren't feeling alone and isolated out there. So visit us on our website if you'd like to learn more about joining a online clinical consultation group or connecting with a group of other private practice therapists who might be feeling alone and isolated, just like you are.
Awesome. Thank you so much for being on the Practice of the Practice podcast.
Thanks, Joe. It was a pleasure.
Well, thank you so much for listening today. If you need clinical supervision, head on over to firelightsupervision.com, or if you want clinical consultation. Either way, though, keep thinking through what your clinical confidence looks like. Where do you feel inadequate? Where do you feel like you need some support? I know that for me, there was some different types of specialties that when they came in, it was like, do I need to refer out to this, or do I have the skills? And kind of figuring that out and getting consultation from other clinicians was really important. And talking with the clients to say, hey, I haven't dealt with this particular niche before. I think that there's a lot of overlap between what I have done, but I want to make sure that you feel good about that. There's so many different ways that you can kind of build your clinical confidence, build your clinical skills, and just build your personal human skills. If we're not growing, if we're not becoming better people or better versions of ourselves, like, what are we doing? Not that it always has to be some achiever, I'm going to become some superhuman, but I hope that as a father, that as a partner, as just a friend, that I work on the things that are triggering for me or that are tough for me so that I can be the best version of myself as I enter into the world. Also, we could not do this show without our amazing sponsor. Therapy Notes is our sponsor for today. Therapy Notes is the best electronic health records out there. Just recently, I was talking with a consulting client who switched over from another platform, had such an amazing switch with all of their clients, and then also is doing the whole teletherapy thing through it and has billing embedded in it so that the clients can get billed correctly. It's just made their lives so much easier. So if you want to try Therapy Notes, head on over to therapynotes.com. Use promo code Joe at checkout to get a couple months for free. Also, if you use that promo code, that helps Therapy Notes know that their podcasting money is working. They put their money into shows like this, and they want to know that it works. So use promo code Joe at checkout. Thank you so much for letting me into your ears and into your brain. Have a great day. I'll talk to you soon. Special thanks to the band Silence is Sexy for that intro music, and this podcast is designed to provide accurate and authoritative information in regard to the subject matter covered. It is given with the understanding that neither the host, the producers, the publishers, or guests are rendering legal, accounting, clinical, or other professional information. If you want a professional, you should find one.